Hello and welcome. My name is Dr. Michael Mosley. Today, we're going on a fascinating journey deep inside the human body to explore the gallbladder. This unsung hero plays a crucial role in our digestive system, working quietly behind the scenes to help us process the food we eat. Few truly understand its vital function as an integral part of a complex network that includes your liver and small intestine. Think of it as a small, highly efficient reservoir. Its main job is to store and concentrate bile, a greenish-brown fluid produced by your liver, essential for breaking down fats from your diet. Without the gallbladder's careful management of bile, digesting a fatty meal would be a much more difficult task for your body. Throughout this guide, we will delve into the specifics of how this amazing organ works. Our goal is to demystify this organ, replacing confusion with clarity and concern with confidence. Issues with the gallbladder are surprisingly common, affecting millions of people around the world. That is why taking the time to learn about it is so valuable. So let's begin our exploration of this small but essential organ. In the sections that follow, we will cover everything you need to know about your gallbladder. We will start by examining what it is, where it's located, and how it fits into the broader digestive system. We will then take a closer look at its function, explaining the remarkable process of storing and releasing bile. Understanding the how and why of its daily operations is fundamental to appreciating its importance. We will use clear illustrations and simple explanations to make this complex biological process easy to grasp. We want to ensure you have a solid foundation of knowledge about how your body works. Of course, we will also discuss what happens when things go wrong. We will dedicate a significant portion of our journey to exploring common gallbladder problems, such as the formation of gallstones, inflammation, and other, less common conditions. We will detail the symptoms to watch out for, from mild discomfort to more severe pain, helping you to identify potential warning signs. By understanding the causes and risk factors associated with these conditions, you can become more proactive in safeguarding your own health. This knowledge can help you and your doctor work together more effectively if an issue ever arises. Furthermore, we will walk you through the process of diagnosis and treatment. If you do experience symptoms, what can you expect? We will discuss the various tests that doctors use to investigate gallbladder health, from simple ultrasounds to more advanced scans. We will also outline the range of available treatments, including lifestyle modifications, medications, and surgical options like gallbladder removal, which is a very common and safe procedure. Our aim is to demystify the medical process, providing you with a clear, reassuring overview of the modern approaches to managing gallbladder conditions effectively and safely. Finally, and perhaps most importantly, we will focus on prevention. We will provide practical, evidence-based tips on how you can maintain a healthy gallbladder through diet and lifestyle choices. Small changes can often make a big difference in reducing your risk of developing problems down the line. We will also provide clear guidance on when it is essential to seek medical advice. Knowing when to consult a doctor is crucial. By the end of our discussion, you will not only understand your gallbladder, but also feel equipped with the knowledge to support its health for years to come. Let's get acquainted with the gallbladder. It's a small, greenish-brown, pear or balloon-shaped organ about 3 to 4 inches long. The gallbladder is hollow, designed for bile storage. Its muscular walls allow it to contract and expand. The inner lining has folds that increase surface area, making it efficient at concentrating bile by absorbing water. This concentrated bile is then released to digest fats. The gallbladder has 3 main sections: the fundus, body, and neck. The neck connects to the cystic duct, the exit route for bile. The neck's S-shaped curve acts as a valve to control bile flow. The gallbladder's anatomy is perfectly tailored for its vital role in digestion. Now that we know what the gallbladder looks like, let's talk about its location. Where exactly does this pear-shaped organ reside inside our bustling abdominal cavity? The gallbladder is tucked away in a shallow depression on the underside of the liver, which is the largest solid organ in your body. It sits in the upper right quadrant of your abdomen, just below your rib cage. This close relationship with the liver is no coincidence. The two organs are partners in the business of digestion. The liver produces the bile, and the gallbladder, its next-door neighbor, stores and manages it for later use. This strategic placement is essential for the efficient transfer of bile. A network of tubes known as the biliary tract or biliary tree connects the liver, gallbladder, and the first part of the small intestine, called the duodenum. Think of it as a plumbing system. Tiny ducts within the liver collect the bile it produces and channel it into larger right and left hepatic ducts. These two ducts join to form the common hepatic duct, which runs directly from the liver. This main pipe then connects with the cystic duct from the gallbladder, forming the common bile duct, which leads down to the small intestine. This interconnected system ensures that bile can travel seamlessly from its production site in the liver to its storage facility in the gallbladder, and then on to its final destination in the small intestine when needed. The close proximity of these organs means the journey is short and direct. When you haven't eaten for a while, a sphincter or muscular valve at the end of the common bile duct closes. This causes bile produced by the liver to back up through the cystic duct and into the gallbladder for storage, preventing it from being wasted and ensuring a ready supply. This anatomical neighborhood, with the liver as the factory and the gallbladder as the warehouse, is a perfect example of the body's incredible efficiency. The gallbladder isn't floating around randomly. It is precisely positioned to work in concert with its partners. This integrated system allows for the carefully timed release of bile, synchronized perfectly with our eating patterns. Its location ensures it can respond rapidly to the hormonal signals that are sent out after a meal, especially one rich in fats, making it a critical player in the digestive team of the upper abdomen. Let's venture inside the gallbladder to explore its internal structure more closely. The wall of the gallbladder is not just a simple membrane, it's a multi-layered structure. The innermost layer is the mucosa, which is made of epithelial cells. This layer absorbs water from the bile, making it up to 15 times more concentrated than when it first arrived from the liver. The highly folded nature of this mucosal layer, creating tiny ridges, maximizes the surface area for efficient absorption. Just beneath the mucosa lies a layer of smooth muscle. This muscular wall gives the gallbladder its ability to contract forcefully. When your body signals it's time to digest fats, this muscle layer squeezes, much like squeezing a tube of toothpaste. This contraction pushes the concentrated bile out of the gallbladder, through the cystic duct, and into the common bile duct. From there, it flows into the small intestine to break down fats. This muscular action is involuntary, controlled by hormones and nerve signals you're not consciously aware of. Surrounding the muscle layer is connective tissue, containing blood vessels and lymphatic vessels. These vessels supply oxygen-rich blood and nutrients and carry away waste products. The outermost layer, the serosa, is a smooth membrane covering the gallbladder surface. This membrane anchors the gallbladder against the liver and allows smooth movement without friction. Each layer plays a critical part in the gallbladder's function. From the absorptive inner lining to the powerful muscular wall and protective outer coating, this is biological engineering at its finest. It's not merely a passive container, but an active, complex organ. This design allows it to store, concentrate, and eject bile with remarkable precision. Understanding this complexity helps us appreciate why maintaining these layers is crucial for digestive function. To understand the gallbladder, we must first look at bile. Bile is a greenish-brown fluid essential for digestion, produced continuously by the liver. The liver, a powerhouse organ, manufactures up to a liter of bile daily from components like cholesterol, bile salts, water, and bilirubin. Once produced, bile flows through a network of ducts. Bile collects in the hepatic ducts, which form the common hepatic duct, the main exit from the liver. From here, bile has two paths. During digestion, it flows into the small intestine. Between meals, the gallbladder stores bile. The sphincter of Oddi prevents bile from entering the gut needlessly. With the exit blocked, bile backs up. It travels up the cystic duct to the gallbladder, acting as a reservoir until needed. This prevents wasteful dripping of bile. This process exemplifies the body's efficiency. Once bile arrives in the gallbladder, its work continues. The gallbladder actively concentrates bile. Its primary function is to concentrate the bile. Bile from the liver is dilute, about 97% water. Storing this volume would require a much larger organ. The inner lining of the gallbladder, the mucosa, absorbs water. This membrane absorbs water and electrolytes, sending them back into the bloodstream. This absorption is effective. By removing water, the gallbladder reduces the bile volume up to 15 times. It holds hours of bile production in a small space. What remains is a concentrated solution of bile salts, cholesterol, and bilirubin. This concentrated bile is more effective at breaking down fats. The gallbladder typically holds 30 to 60 milliliters of concentrated bile. It's a potent supply for digesting fatty meals. The muscular walls remain relaxed during storage. The gallbladder's dual role makes it valuable. The gallbladder stores and concentrates bile until you eat, especially fats or proteins. Food moving into the duodenum triggers a sophisticated signaling system. Cells release cholecystokinin, or CCK, into the bloodstream. CCK signals the gallbladder to contract. It also tells the sphincter of Oddi to relax and open. Bile is propelled out of the gallbladder and into the duodenum, mixing with food. Bile emulsifies fats, breaking them into tiny droplets. This makes it easier for enzymes to break them down and for your body to absorb them. This happens automatically every time you eat a fatty meal. Once the fat content decreases, the gallbladder relaxes, ready for your next meal. By far the most frequent issue to affect the gallbladder is the formation of gallstones. These are small, hard deposits that form inside the organ. Gallstones can vary dramatically in size. It's even possible to have a single large stone or hundreds of tiny ones. They develop when substances that make up bile, particularly cholesterol and bilirubin, become overly concentrated and crystallize. There are two main types of gallstones: cholesterol stones and pigment stones. Cholesterol stones are primarily made of excess cholesterol. Pigment stones are made of bilirubin. Many people with gallstones never experience any symptoms at all. Problems arise when a stone moves and blocks one of the bile ducts, causing intense pain. When a gallstone blocks the cystic duct, it can cause cholecystitis or gallbladder inflammation. Bile becomes trapped, putting pressure on the gallbladder walls, causing irritation and swelling. Cholecystitis can be acute, coming on suddenly, or chronic, developing over time. Acute cholecystitis is a medical emergency. Symptoms include severe abdominal pain, fever, chills, nausea, and vomiting. Chronic cholecystitis involves long-term inflammation, often from repeated gallstone blockages. The gallbladder walls can thicken and lose their ability to store bile. While gallstones are the main cause, a calculous cholecystitis, or inflammation without stones, can occur in critically ill patients. Regardless, gallbladder inflammation is serious and requires proper treatment. Sometimes, gallbladder problems occur without stones or sludge. One such condition is biliary dyskinesia, where the gallbladder is structurally normal, but doesn't function correctly. Its ability to contract and empty bile is impaired, leading to digestive symptoms and discomfort. The primary symptom is pain in the upper right abdomen, often after eating fatty meals. Standard tests may show a normal gallbladder, making diagnosis challenging. Doctors use a HIDA scan to measure the gallbladder ejection fraction. A low ejection fraction suggests malfunction. The causes aren't fully understood, but it's considered a motility disorder. Treatment involves diet management or, in severe cases, gallbladder removal. Another finding on a gallbladder ultrasound can be a polyp. Gallbladder polyps are small growths of tissue from the inner gallbladder wall. Mostly these are benign and don't spread. They're often found during ultrasounds for other issues. Most are cholesterol polyps, not tumors, but small cholesterol deposits. Most don't cause symptoms and are harmless. Larger polyps can cause symptoms like gallstones. Symptoms can include abdominal pain, nausea, or bloating. While most are benign, there's a small cancer risk. Doctors check the size to assess this risk. Small polyps under 10 mm are unlikely to be cancerous. Doctors may recommend regular ultrasounds to monitor them. Larger polyps or rapid growth increase cancer risk. Doctors might recommend gallbladder removal to prevent potential problems. While most gallbladder problems involve stones or function, rare but serious conditions exist. Gallbladder cancer is uncommon but dangerous, often detected late due to vague symptoms like pain, weight loss, and jaundice. Chronic inflammation, especially from long-term gallstones, is the main risk factor. Other risks include large polyps, being female, and porcelain gallbladder, a rare calcified condition. Because it's usually found late, gallbladder cancer has a poor prognosis, making early management of chronic issues crucial. Another emergency is a perforated gallbladder, where severe inflammation causes a hole, leaking bile and leading to life-threatening peritonitis. Symptoms include sudden severe pain and high fever. This requires immediate surgery. Cholecystolithiasis is when a gallstone blocks the main bile duct, causing pain, fever, jaundice, and sometimes infection. This blockage needs urgent treatment, often with a procedure called ERCP to remove the stone and restore bile flow. These rare complications highlight why prompt attention to gallbladder symptoms is so important. Early detection and intervention can be life-saving. Don't ignore persistent or severe symptoms. Always seek medical advice if you suspect a serious gallbladder issue. If you have upper abdominal pain or digestive symptoms, your doctor will start with a detailed history and physical exam. A key sign is Murphy's sign: sharp pain under the right rib when you inhale as the doctor presses. Blood tests check for infection and liver function, revealing clues like high white blood cells or elevated bilirubin. The main imaging test is abdominal ultrasound, which detects gallstones and inflammation. Ultrasound is non-invasive and usually provides enough information for diagnosis. If results are unclear, further tests like a HIDA-scan CT scan for complications or MRI ERCP for bile duct issues may be used. These tests help pinpoint the problem and guide treatment. Quick, accurate diagnosis is key to preventing complications. If you have persistent symptoms, don't delay seeking evaluation. Early testing can make a big difference in outcomes. Trust your instincts and communicate symptoms clearly. Your doctor's goal is to find answers and get you feeling better. Treatment depends on your diagnosis and symptom severity. Silent gallstones often need no immediate treatment, just healthy lifestyle changes and monitoring. A low-fat diet and regular exercise can help prevent future problems. Mild, infrequent attacks may be managed with pain relief and, in some cases, medications to dissolve small cholesterol stones. These medications work slowly and aren't always permanent solutions. Acute cholecystitis usually requires hospital care, IV fluids, pain control, antibiotics, and fasting to rest the gallbladder. Once stable, surgery may be considered. For functional issues like biliary dyskinesia, lifestyle changes, smaller, low-fat meals can help. If symptoms persist, surgery to remove the gallbladder is often the best long-term fix. The right approach is tailored to your needs and health status. Always follow your doctor's advice for the safest outcome. Early management prevents complications and improves quality of life. For most with symptomatic gallstones or severe gallbladder issues, surgery, cholecystectomy, is the definitive treatment. Laparoscopic surgery is the standard: small incisions, a camera, and quick recovery. The gallbladder is removed, eliminating stones and inflammation for good. Open surgery is sometimes needed for complex cases or severe inflammation. Both methods are effective, but laparoscopic offers less pain and faster healing. After surgery, bile flows directly from the liver to the intestine. Most people adapt well. Some may have temporary digestive changes, but these usually resolve. Living without a gallbladder is manageable. Most return to normal diets. The surgery is safe and provides lasting relief from painful symptoms. If you're facing gallbladder surgery, know it's a common and successful procedure. Discuss any concerns with your surgeon. Recovery is usually smooth, and life without a gallbladder is healthy and normal. You can lower your risk of gallbladder problems with smart lifestyle choices. Eat a diet rich in fiber, fruits, vegetables, and whole grains to support digestion and healthy weight. Limit saturated fats and processed foods, which raise cholesterol in bile and promote stones. Maintain a healthy weight, but avoid rapid weight loss. Lose slowly for best results. Regular exercise, like brisk walking or swimming, improves metabolism and gallbladder function. Healthy fats: olive oil, avocados, fish, may protect against gallstones. Stay hydrated to keep bile fluid and less likely to crystallize. Some studies suggest coffee may help, but moderation is key. These habits benefit your whole digestive system, not just the gallbladder. Prevention is easier than treatment. Start healthy habits early. Small changes add up to big health benefits. Take charge of your gallbladder health today. Your future self will thank you. Recognizing warning signs is crucial for your health. Persistent upper right abdominal pain, especially after fatty meals, should prompt a doctor's visit. Don't ignore chronic bloating, nausea, or unexplained digestive symptoms. Seek urgent care for sudden severe pain, fever, or inability to get comfortable. These may signal a gallbladder attack. Jaundice, yellow skin or eyes, dark urine, pale stools means bile flow is blocked and needs immediate attention. These symptoms can indicate serious complications like infection or pancreatitis. Early intervention prevents worse problems and speeds recovery. Trust your instincts. If something feels wrong, get checked. Open communication with your doctor leads to better outcomes. Don't wait for symptoms to worsen. Timely care can be life-saving. Your health is worth prioritizing. Act early and stay informed. We've reached the end of our exploration of the gallbladder. This small, pear-shaped organ plays a significant role in our digestive health. We learned about its anatomy, its relationship with the liver, and its location. It stores and concentrates bile to help digest fats. We also covered problems like gallstones and cholecystitis, detailing symptoms like abdominal pain and nausea. Modern diagnostics and treatments are available, including surgery. Understanding your gallbladder empowers you to support its health. A balanced diet, healthy weight, and regular exercise are powerful tools. Thank you for joining this exploration. Make informed decisions about your health, listen to your body, and consult a doctor when needed. Your health is valuable, and being knowledgeable is the best way to protect it.